I'm here with Judy, and we're just talking about revision surgery. So let's just back up and talk about how long ago you had your original hip replaced and what led up to the revision.
Okay, well, I had my original hip replaced about 24 years ago.
Yeah.
And I felt like I had the best there was done.
Yes.
And I followed the doctor's directions to the T, and got my mobility right back at that time in 6 weeks, and went right on with my life.
Great. And when you had it replaced 24 years ago, that was a second generation hip, which means it was really good, but it was designed to last about 15, maybe 20 years. So you were well past your grace period at 24 years. Tell us about what led up to the need to revise it.
Well, I mean, the need to have done something about getting rid of the hip pain probably had happened 10 years ago, because I'm a person that likes to do, this isn't in your bailiwick, but I like to do things that require a lot of walking, flea markets, shows, antique shows and things like that. So they require a lot of walking. And 10 years ago, it was definitely a matter of pill taking. Yeah. So it was Excedrin, 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 and I pushed it, and then I had doctors look at it, and the doctors that looked at the condition it was in, say 8-9 years ago, they also would look at my other hip, which was the natural hip, and they'd say, "Are you sure that you can even walk on the other hip, the right hip?" So it was a back and forth, and then I was able to get medication that would allow me to do most of what I wanted to do, but not all of what I wanted to do.
Okay.
And I always had good doctors around me, but I didn't feel that I just didn't feel I was up to the whole hip surgery thing.
Yeah. Okay. Well, let's talk about that, because the implants that you had put in were great and they were state of the art, but all things mechanical eventually wear out. And yours was wearing out. It was starting to cause some symptoms, but you felt like you could manage those with medications.
Mm-hmm.
And was there a certain point where you decided, I can't keep doing it with medications. I actually have to take care of the structure?
Well, I talked to myself like that, but then I was older, and the doctor that I was familiar with was older, and I really didn't, and I didn't look wholeheartedly, but when I looked around, I felt like the other thing that was interesting is I don't think when I had my hip put in, I don't think
24 years ago,
I didn't get this wasn't forever. I thought it was like you take out an appendix and you're finished with it.
Yeah.
But so I got a great hip, and I've told people that many times, and I thought it was forever. And the cards that I got in the mail to come in and have a
periodic
follow-up, to me, was afraid that I would have to face another surgery. So, it was kind of a vicious circle for me, but this is...
Yeah, so the checkups are there to make sure that everything is in working order and to be able to identify problems before something structural or significant happens. And that's why we recommend that patients come in every 3 to 5 years, just so that we can keep track of the components.
Do you do that?
Yeah, yours wore out.
Well, it still wasn't, so it probably was in worse shape than my right hip.
Yeah.
But 2 years ago, I had my right hip fixed.
Tell me what finally made you decide it was time to get this taken care of.
Okay, it was just like a comedy of errors, or things came together. My doctor was out of town. Another physician was overseeing his practice, and he had set me up to have a hip MRI. Because I was having so much pain in my lower back, and so I took my time getting it, and it just so happened that came back through the practice when one of the other doctors was looking at it, and he saw that, was it a crack or
Fracture.
fracture, he called it, in my femur, and that was like, that just scared me to death.
Right, there was so much wear in the hip, it had caused debris, which caused your bone to become brittle, so it actually broke it off. Now,
Mhm.
fortunately, your implants had loosened, but there had been so much delay in wear that your bone had become brittle and started breaking. So you're starting to get spontaneous fractures in your hip.
And spontaneously enlarged problem for me. I mean, it was talking now about femurs and wires and all kinds of things, and that then put me on, you know, a track that I wanted to be in control
Sure.
of having the best care for whatever this is called a revision. The first time I ever heard the word revision was when I went in after I'd been called on a Sunday night at home telling me that I had a fractured femur. And I went in to see the doctor, and then he explained to me that this is a complicated situation, and this is something that I don't do it, and you're going to need to find someone that will do that for you, because he again, when it started going through the drama of saving muscle and way beyond my intellect, and so what was good luck for me was that my husband, that's listening to me and all the talking that I've done to people, he went to the source. He went to Dr. Moreland and called him, and after 25 years, I'm sure that Dr. Moreland didn't remember exactly who I was, but he was just right there for me, and everything fell into pieces. And when I met you were the second person that I'd met when I knew that I was talking about a revision,
Yeah.
and I kind of knew what a revision was. You were the second person, but you were the first person that gave it a positive spin. This isn't like tearing the whole leg apart and doing all these things. You just laid it out as if it was my car that I hadn't taken care of for 20 years, and how could I expect it to still be shifting into neutral every day? So that was really important, and I would think professionally it would be, with all of us old people aging to the point where we do have a used part, and I bet there are a lot of people going around just like me
A lot of
that
people.
aren't getting it fixed, and if they knew they could get it fixed, and
Yeah.
I mean, like if you said to me, what's bothering you today, the first thing and I'm only 24 days out of surgery or
Yeah,
something.
just a little over 3
I
weeks.
count, yeah.
Yeah.
And you would be surprised at how good I could. I mean,
Yeah, let's see you walk.
I never used a cane, and I didn't use a walker. I just came home and walked. Okay, and the thing that was irritating me was my shoulder.
Yeah.
But there's I'm careful. I don't go spinning around on my toes.
Yeah.
But this compared to, and I just 2 years off of having this hip, just
Sure.
right hip done, and I would say that probably definitely easier.
Yeah, and the good news about this mechanically is that this is a third generation part, and the engineers expect this new part that we put in to last 30 years. Any words of advice for people who were in your same situation, who have an older hip, it's wearing out, or looking at a revision? What would you tell people?
Well, I'd certainly get it done the sooner the better, and I would be very concerned about it becoming a big crisis when it can be check in, I had a super experience in this hospital, and I walked in and I walked out. We had, people might think it's strange, but we had valet parking, and we were valeted in and valeted out, and normally you can't even do that in a hospital. So that they must have felt pretty good about the condition I was in.
Yeah.
Right?
Anything to add as you were watching your wife go?
Well, I'd say, if you have any questions, get it done now. In other words, investigate it, come see the doctor and get your evaluations and follow through on it. Because in the last 2 or 3 years, friends and acquaintances around us have had their hips done and have had problems, and we've seen it, and it made it more and more aware for Judith and the pain level. You can't go around taking 4 or 5 Percocet a day, and
Right.
you know, you've got to take care of the
structural
problem, not this, you know, and get to the solution. So you really need, and it made my life a lot easier because I was really 24/7 right there with her.
Well, thank you so much for sharing your story. I know this helps a lot of people dealing with the exact same situation you're talking about. So thank you.